Hello friends, welcome to my presentation. Myself Ajin Shah. Today I am here to present a video on the topic knee complex part 2. First we can see the alignment and weight bearing forces of knee joint. The anatomical or longitudinal axis of femur is oblique, directed inferiorly and medially, and the tibia is directed vertically. Here, the femoral and tibial longitudinal axis form an angle medially at the knee joint of 195 degree to 190 degree. In bilateral static strains, equal weight distribution on medial and lateral condyle. Deviation in normal force distribution. If the tibiofemoral angle is greater than 190 degree, then the condition is known as genu valgum, which compresses lateral condyle. And the tibiofemoral angle is less than 180 degree, then the condition is known as genu varum, which compresses medial condyle. Compressive force in dynamic knee joint, that is 2 to 3 times body weight in normal gait and 5 to 6 times body weight in activities like running, stair climbing, etc. Menisci of knee joint. To asymmetrical fibrocartilaginous joint is called menisci, which is located on the tibial plateau. There are two menisci, medial meniscus and lateral meniscus. The medial meniscus is semicircular in shape and the lateral meniscus is 4 by 5 of ring. Both menisci are open towards intercondylar area and they are thick in peripheral region and thin centrally forming cavities for femoral condyles. By increasing congruence, menisci play in reducing friction between the joint segment and serve as shock absorber. Meniscal attachment. Both menisci is attached to intercondylar tubercles of the tibia, tibial condyle via coronary ligaments, patella via patellomeniscal or patellofemoral ligament, transverse ligament between two menisci, and the anterior cruciate ligament. Unique attachment of medial menisci is medial collateral ligament and semitendinous muscle. Unique attachment of lateral menisci is anterior and posterior meniscofemoral ligament, posterior cruciate ligament and popliteus muscle. In young children whose menisci have ample of blood supply have low incidence of injury, but in adults only the peripheral vascularized region is capable of inflammation, repair and remodeling following a tearing injury. Menisci are well innervated with free nerve endings and 3 mechanoreceptors. Next we can see about knee joint capsule. Joint capsules restrict various movements. It helps to maintain joint integrity and normal joint function. Outer portion is firmly attached to the inferior aspect of femur and superior portion of tibia. Posterior attachment. Proximally to posterior margins of the femoral condyles and intercondylar notch. Distally to posterior tibial condyle. Anterior attachment. Superiorly patella, tendon of quadriceps muscles. Inferiorly, patellar tendon complete the anterior portion of the joint capsule. The joint capsule is reinforced medially, laterally and posteriorly by capsular ligaments. Next we can see about extensor retinaculum. The anterior medial and anterior lateral portions of capsule are known as extensor retinaculum or medial and lateral patellar retinacula. It has two layers, superficial layer and deep layer. First we can see deep layer, which connecting the capsule anteriorly to menisci and tibia via coronary ligament. Superficial layer mixed with vastus medialis and lateralis muscle and distal continue to posterior femoral condyle. Next we can see about synovial lining. The intricacy of fibrous layer capsule is surpassed by its synovial lining except posteriorly. Synovium adheres to anterior aspect and side to the ACL and PCL. Embryologically, the synovial lining of the knee joint capsule is divided by septa into 3 separate compartments: superior patellofemoral compartment, medial tibiofemoral compartment, and lateral tibiofemoral compartment. Bursa associated with knee. First, prepatellar bursa, located between the skin and anterior surface of patella. They allows free movement of skin over patella during knee flexion and extension. Subcutaneous bursa, which is located between patellar ligament and overlying skin. Next, deep infrapatellar bursa, located between patellar ligament and tibial tuberosity. helps in reducing friction between the patellar ligament and tibial tuberosity. Thank you all for listening to my presentation.